With examination of any low back pain, a clinician should first screen for general red flags, followed by red flags that are specific to the low back. Examples include a recent infection that may have spread to the spine or may now be causing septic arthritis. Another example is cancer, which may present with unexplained weight loss and unrelenting night pain. Spinal cord compression may present with an ataxic or clumsy walking pattern, as well as pins, needles, or numbness in the legs. Another type of spinal cord compression that occurs in the distal cord is called cauda equina dysfunction, and this presents with difficulty urinating, loose stools, a numbness in the pelvic floor, and an inability to raise the foot at the ankle joint or dorsiflex the foot. Lastly, if someone has experienced a recent trauma, especially if they have a history of corticosteroid use, they may require screening to rule out a fracture and possible imaging studies. Once red flags have been ruled out, a clinician can move forward with an examination of posture, looking particularly for a lateral shift or lateral list, where the shoulders are shifted away from the hips, indicating a disc bulge or herniation to the opposite side, where the shoulders are now shifted away from the pain. If a shift is not present, further examination is required, and the rest of the exam can be divided into two very simple categories: people whose pain feels worse when they bend forward, and people whose pain feels better when they bend forward. If you have more pain when you bend forward, you're likely dealing with a disc problem. It may be a disc bulge, herniation, a disc tear, or flattening of a disc. Disc pain is usually worse with any forward bending, including bending forward to tie your shoes or sitting in a chair with a slouched posture, and oddly enough, when a person sneezes or coughs due to the compression that this puts on the disc. Disc pain is usually episodic, lasting for about 2 weeks, then it goes away for a period of time, and it flares back up. Now, if you only have pain during a segment of forward bending, let's say it doesn't hurt at the beginning, but you get to a certain point where there's more pain, but if you get past that point, there's less pain, you may be dealing with segmental spinal instability. This is correlated with a previous disc injury that now allows for more movement at one segment of the spine. So to recap, most all pain that occurs with forward bending is typically due to a disc problem. Moving on to the next category, if you have less pain when you bend forward or relief when you bend forward, you're likely dealing with one of three things. If you're a younger person under the age of 55, you're likely dealing with facet joint irritation, and rarely you may be dealing with an anterior spondylolisthesis, where one of the vertebrae is shifted too far forward, but that's a rarer occurrence. People who have relief when they bend forward are usually over the age of 55, and they're usually dealing with arthritis or stenosis. Arthritis and stenosis are synonymous in the low back, and this occurs because areas of the spine narrow and compress the nerves. It feels better when you bend forward because this opens up those areas and decompresses the nerves. Most low back pain is due to a disc problem or arthritis. Either of these issues can cause sciatica, or pain that shoots down the leg. And either of these issues can cause muscle pain. Muscle pain is usually not the root cause. It's more likely associated with a deeper issue. So muscle pain as a sole diagnosis is usually a misdiagnosis of low back pain. So to recap, if you have a lateral shift, you likely have a disc bulge or herniation to the opposite side. If it feels worse when you bend forward, you likely have a disc problem. If it feels better when you bend forward, you're likely dealing with arthritis, especially if you're over the age of 55. So hopefully now you have a better understanding of a general low back pain examination, and now you'll be all the more empowered the next time you visit your clinician. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, If you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.